With the country still clear of the Omicron variant, what other precautions must be put in place to ensure that our COVID numbers continue to come down? That big question and more with infectious disease expert Dr. Rontgene Solante. Dr. Solante, welcome again to The Big Story.
Yes, Robbie, good evening.
Dr. Solante, ilang beses na po na tayo nag-uusap dito. I don't think we've ever started off a newscast that way with that optimistic numbers. Is there any other way to take those numbers other than this is really, really good news?
Well, this is the first time that this is a good news. When we have those numbers, I'm really happy. And if you look at the hospital utilization now, and even in San Lazaro, it's way far. We would expect that it will happen even at this point in time when we have the Omicron variant. And in fact, Robbie, we still have the Delta variant. And other countries, we're still reeling with the Delta variant. But we are in a better place and we are in a better situation now compared to 2 months or a month ago.
Okay, now the but. Ipasok ngayon natin, Omicron. Ipasok natin sa picture. As you keep saying, and as everybody keeps saying, there's an element of inevitability here. It's not a matter of when they said. It's a matter of, it's not a matter of if, it's a matter of when magkakaroon ng Omicron. First of all, what are we doing right? And where are the cracks? And even in a worst case scenario, if Christmas may pumasok na Omicron, what might be looking at in terms of the charts?
First, we're doing good with the vaccination. And I think the November, the vaccination, national vaccination days, that will be, again, the second part, will be a very vital program that because we will be vaccinating more Filipinos now. And we are buying time until such time Omicron variant will come in or will be present here. At least a lot of the Filipinos are already vaccinated. Second is that we need to continue the surveillance, the biosurveillance. And that's very crucial. If there are less sample to be tested, less sample to be sequenced, then we don't know if this variant of concern is already here. No? So we still encourage everyone, if you have symptoms, you need to have active surveillance, you need to be tested. And of course, third, we need to be very careful even during the holidays. And we should not like be, it's okay kasi wala pa namang Omicron variant. We should treat each day as Omicron is here and we should be very, very careful.
Ay, sundutin ko lang po yung sinabi nyo sa biosurveillance. Tama ba that, that as the numbers come down at lumiliit yung sampling natin, there's actually a risk, a danger that we might lose track and we might not be monitoring enough? Yes,
correct. And the catch here is that if Omicron variant of concern will only present with a very mild symptoms, then it's difficult for everyone to just go to the laboratory and have himself tested. We know that during December, we also have the flu season and other upper respiratory tract infection. But again, that should not be the reason. If you have symptoms and you are vulnerable and you are living with a vulnerable person at home, then you have to isolate and you have to be tested.
Okay, Dr. Rontgene Solante, maraming salamat po. In an effort to prevent the entry of the new variant, first reported in South Africa, the Philippines has just expanded its red list. Portugal is the latest addition to that list, meaning travelers from the European nation will be subject to more stringent testing and quarantine requirements. A negative RT-PCR test is needed for 3 days before departure. Facility-based quarantine is also required. The ban will take effect starting December 12th. VEP Chairperson Dr. Nina Gloriani, meanwhile, tells One News, the chiefs, that 3 vaccine brands are currently under review for minors below 12 years old. These brands are Pfizer, Sinovac, and Covaxin. The panel may release the recommendations by January next year. And the IATF has raised the cap on healthcare workers going abroad to 7,000. This is a 500 slot increase from the 6,500 cap in June. Other nations earlier urged the Philippine government to discard the entire deployment ceiling.